We're doing land nav, right? Or
No,
first aid?
we're doing first aid.
All right.
So we got to get through 3 PowerPoints today.
I just taught this like a few days ago.
So this is because we only got an hour. This is going to be.
No, it'll be. This will get done within like 30, 40 minutes.
We'll do the practical stuff of putting the tourniquets on and checking casualties when we get to the FTX next weekend. So this is just going to be really boring and dry for you, but you got to do the PowerPoint before you get to the hands-on. Fundamentals of first aid: a thorough understanding of the fundamentals of first aid can save a life, prevent permanent disability, or reduce long periods of hospitalization by knowing what to do, what not to do, and when to do it. All right, so your learning objectives: describe fundamental terminology, explain, evaluate a casualty, open an airway, apply combat tourniquet if needed, perform first aid. All right, so go down the list. I'm going to start with, what's a CASEVAC? What do you think a CASEVAC is?
I got you. All right. So real quick, right? So terminology, things you're gonna hear a lot in regards to first aid. Okay, all these things. Casualty evacuation, we call it CASEVAC. All right. It's important to know the difference between this and medevac. CASEVAC, vehicles, ambulatory. All right. So I'm a platoon sergeant. You're my PL. We're coming up with a plan. I'm gonna have 2 plans if we have a casualty within our platoon. I'm gonna have a CASEVAC plan where we get them out via vehicle, and the medevac plan where we get them out via helicopter. All right, so when you hear CASEVAC, it's ground evacuation for a casualty, and medevac is helo, air, okay?
No, that's almost right. Medevac means a medical transport, okay? So an ambulance, it could be a medical helicopter, but CASEVAC means it's just, we found a POV and we're driving. All right, that's the difference. Okay, CASEVAC is any evacuation done with non-medical equipment.
But the rest of these here, you're going to hear about a lot, okay?
Combat Lifesaver, you will go through it. Every unit, you're going to need to know this when you come, PLs, company commanders. Your unit has to have a threshold of Combat Lifesaver certified people within your unit. The best way to do that, you go through Combat Lifesaver in basic training. So when you get new basic trainings, they're already certified. I think the certification runs out every 2 years. It's valid for 2 years. So as you get normal turnover over the years you're in service, you just get the basic trainees or AIT that have graduated, and they fill up your company. It's just the easiest way. If not, maybe you have a more experienced company, so you're going to have to retrain your people every so often to keep that number up. That's an officer reporting thing that you need to be aware of.
With that, your platoon sergeant, your first sergeant, we'll keep tabs on that because we deal with medical directly, and our medics will ensure that people who are expiring on their CLS or combat lifesavers are getting retrained as necessary. So it's not anything you have to necessarily stress about at all. Okay.
And it's not like a 1 hour class. It's like 40 hours.
It's a week long.
Yeah.
It's very basic. All right.
Okay, emergency medical treatment, first aid, self-aid, and buddy aid. If you can treat yourself, then you treat yourself. Okay? If you get shot in the arm, you can probably use your other hand and wrap it up and put tourniquet on yourself. Okay? Try yourself. You save yourself first, and then you go to the buddy aid. Kind of like in an airplane, right? You put your air on first. Your air must come first. Medical treatment facilities. There are 4 degrees of medical treatment. Level 1 would just be in the field. Level 4 would be like Johns Hopkins or somewhere with like a cancer treatment ward, x-ray machines. 1 is in the field, 2 is in the clinic, and then 3 would be getting back to like Germany or something. You're getting back to a first world, but it doesn't have everything that America might have. All right, this is your improved first aid kit. Just get an expert, just kind of read everything that's involved in this. Here we go. You are right. You.
Modular lightweight load carrying equipment, tube, utility pouch,
Okay,
tourniquet.
you guys know what that is, right? On this picture, what's your utility pouch? Or your Molly gear?
It's the pouch itself.
It's the pouch itself, right? So as you can see, I guess it's on the back side of this, right here. You're going to be able to slip this in anywhere on your vest, anywhere that you want it to be, okay? That's the advantage of this Molly system. All right, so next.
Tourniquet, combat application, bandage kit, elastic, bandage gauze, 4.5, 100 packages.
Okay,
Adhesive,
what's 4.5 inches?
4.5 inches,
Is the width,
about there.
right? It's about the size. I guess I got bigger hands. It's about the width of my hand, all right? Anyways, that's the width of it, all right? Go on.
Adhesive tape, surgical, 2x6 roll, airway, nasopharyngeal.
Just say,
Pharyngeal.
we'll call it, just say NPA. That's what we call it
NPA.
for sure. Yeah, because no one pronounces it. Yeah.
Airway, NPA, glove,
Gloves.
patient exam, 100 packages, dressing, combat gauze, insert, holding panels with cord.
What the 2 adds is the custom pouch, a second tourniquet, a marker, an eye shield, commercial chest shield, strap cutter, 1380 form. You know, we love our bureaucracy, combat guys. If you are wounded or someone is wounded, whose medical pack do you use?
The individuals. So if I go down
The
and get
victims.
shot,
Yeah.
if I get shot in combat and you come up to help me, you go in my IFAC, not your own.
Okay.
A couple things real fast. So you guys know what a tourniquet is. We'll talk about it here in a second. The hell was I thinking of? So the NPA, the airway, it's called the NPA. I'm not going to try it. It's a tube. Do you guys know? If you know what it is, cool. If you don't, just say no. Okay. So basically, what it is, there's no picture of it that we can pull up, but it's this tube thing, and it's got like a circle on top. You measure it from like nostril to ear to make sure it's not too long. This is if I have a blocked airway and I can't breathe through my mouth and there's something happening. You stick it in my nose, push down, you feel a little pop, it come down into my throat. Now I'm able to breathe through my nose. So then you essentially keep my mouth closed, and it's not gonna be a lot of air, but it's gonna be enough to sustain life. Does that make sense? That's what an NPA is. Okay. Yeah, next slide, sir.
One of the things you'll see in Hollywood is the guy who has they'll cut right through the throat, and they'll get around that way.
That's a
It's
trach.
anaconda.
That's a trach. The only I've seen it happen once in Afghanistan once, but that's like Navy SEALs and like super duper crazy medics. So we're not doing that at all.
Yeah, it's the movie Anaconda from 30 years ago. That's what it is. Okay, evaluate casualty in the corner. You're not really.
If you're under fire, return fire is directed required before providing first aid.
Okay, what does that mean?
It means provides if you're under fire, fire back and
Yep.
secure before you just start.
Fight first. Okay. Everyone's seen Saving Private Ryan, right? Guys get shot left and right. They keep fighting. Okay. It's not that they're waiting for the medic to come and support, but if you don't fight back, then you're going to become a casualty too. Okay. So you fight first. All right.
Determine casualties alive or dead.
How would you do that?
Get a pulse.
Airway.
So
Checking
so
degree.
listen.
You're probably wearing gloves.
Hold
You're
on.
going to get a pulse. You're probably wearing gloves.
Listen. Care under fire. This is under fire. Return fire is directed, required before providing first aid. So I've got a casualty down right here. I'm back here. I'm shooting. I'm yelling. Determine if the casualty is alive or dead before I move to them. Because if they're not responding, they could either be unconscious or dead, right? We can't really tell until we get up to them, right? But how can we're shooting, how can I determine whether or not the casualty is alive or dead? I can yell, hey, are you good? Hey, can you move to cover? I can yell all these things to them. If they're responding, yes, I'm alive, something, or I'm seeing them move, I can determine if they're not vocal, but they're moving, twitching, whatever the case may be, then I can determine whether they're alive or dead by those types of things. Okay? So that's what we're doing by determining that. Okay? Provide care to the living casualty. So we're going to move up. So direct casualty, return from fire, move to cover, and administer self-aid. That's if they're able to move on their own. Okay? Now, something that we teach all the time in the infantry, EIB, E3B, etc. Determine if the casualty is alive or dead. If the casualty is alive, before you move to them, and we're talking you're getting shot at, they're not able to move, one thing we teach all the time is just yell at them, play dead. Just lay there and play dead. Why? Because the enemy doesn't like to play fair. So if they're alive, the enemy knows that at some point you're going to push out to go get them. And they're going to take you as a casualty. It happens all of the time. But if they play dead, or giving off the impression that they're dead, then the enemy's probably going to shift their fires elsewhere. All right. So one thing you're going to hear a lot of when we talk about care under fire is everything I just said, and then followed by play dead. Does that make sense? All right. And then, like I said, provide care to the living casualty. All right. So then we get into the tactical field care. Go ahead, sir.
Yeah, well, on that note, so there's a pretty famous picture from 15, 20 years ago where the guy is dragging the casualty, and then the next picture is both of them down. All right, so yeah, it happens. I do want to clarify: a casualty does not mean they're dead. Coming from the civilian world, you hear casualty, you think they're dead. It just means they're combat ineffective and they're wounded in some way. That's casualty. All right, technical field care. All right, you go.
Form general impression. Determine level of consciousness using mnemonic AVPU.
So we call it AVPU.
AVPU.
All right, remember this. AVPU is very, very important. I'll give you guys a real life example here in a second. Go on.
A equals alert. B response to voice. P response to pain. U unresponsive. Ask where they feel hurt if conscious. Identify and control bleeding. Open airway. Assess breathing and chest injuries. Check for burns. Administer medications. Document injuries.
All right, so
this is the most important thing you do, right? Document the injuries.
This here, you guys won't do, unless you're like in the medical branch, right? You're not going to do it. So AVPU is how we determine the level of consciousness. Everything in the Army is acronym based to help us remember things, okay? So alert mean like right now I'm talking, right? If I was on the ground, I'm talking, I'm alert. I know where I'm at.
Yeah.
Where
are you alive?
Et cetera, okay? V, response to voice, so verbal, okay? Hey, are you good? Yes. P, response to pain. What's the one way that we can check to see if they respond to pain? You guys ever heard of a sternum rub? You got your sternum right here. You take your knuckles, right? I'm talking. If I'm down and I'm not alert, nor am I responding to your voice, but I'm breathing. You can take your knuckles on my sternum very hard and just start rolling it back and forth. It's going to hurt. If that doesn't work, and my eyes are closed, and you're doing a sternum rub and it's not doing it, you can flip my eyeball. Right? If it hurts, I'm gonna move. Okay. And then obviously use unresponsive. CST this past year. Did you guys hear about what happened with that cadet that passed away? Okay, real quick. So there's this cadet Adara. Land navigation, went out, did his thing, whatever, was coming back. I was walking out of the tent, and on my way out of the tent where they grade the cadet stuff, Cadet Adara was being carried in by some other cadets. Comes in, he was alert, and he was responsive to my voice. We put him in front of the air conditioning unit, right? While we're in front of the air conditioning unit, we're talking. He was a heat casualty. They threw ice sheets on him to bring his core temp down to like 104, right? It was crazy, but they ice sheeted him. What happens sometimes when you ice sheet a person who's overheating is they go into shock. So like within probably a minute of them putting ice sheets on him, which are just regular bed sheets, but submerged in ice water for like an extended period of time, like I said, just shocked the nervous system and sent him to shock. He started having seizures and everything else, right? Once he started seizing up, obviously roll him on his side, rolling back, then he became unresponsive. Wasn't responding to nothing. I went into the pain one, right? Went right into the sternum rub I was telling you guys about. As soon as I hit that chest and started rolling about 2 or 3 times, he gasped for air, woke up, started talking again, started having another seizure. It was just kind of like back and forth, right? Second seizure rolled around. What happens when people seize up? Everything locks up, right? Blood starts coming out of the mouth. I grab his tourniquet, put it in his mouth. He's biting his tongue, yada, yada, yada. Rolling back. He's alert, and then he just passed out again, right? Then I lost the pulse. So while I'm doing all this, I'm checking pulse, right? Determining not just level of consciousness, but I forget. But basically, you got to check for the pulse, right? Make sure he's good. Pulse was non-existent, went right into CPR. So myself and Master Arroyo was another guy out there at CSC, gave him CPR for 28 minutes straight. And long story short, we ended up getting him out of there alive to the medevac. The bird came in, picked him up. They flew him to Louisville, but once he got to the ER, he passed in like 4 minutes, like straight coded, right? The reason I'm bringing this up is it's applicable to AVPU, so it's something to remember. You guys are obviously MS1s, but by the time you're 4s, everything we're talking about now is going to be like second nature to you. But the most important thing that I want to tell you guys when it comes to first aid that we're talking about today You're not there to save the life. You're there to sustain life until you can pass the individual off to higher care. That's why the IFAC that we talked about is very basic. Everything we're teaching you is very basic. Everything I know about medical stuff is very basic, enough to sustain your life until I pass you off to higher echelon of care. Does that make sense? So if you're like, why aren't we getting anything deeper than just this? It's because we're not medics. Okay. So it's medical stuff is very basic at our level, unless anybody, you guys trying to branch like medical, anything? Okay. Yeah. So anything you learn about medical stuff is always be very basic until you get them up to the next echelon of care. That's the point. Right?
I think medic training is like a year long.
Yeah, the 68 whiskeys, which are the enlisted medical folks, combat medics, they've got like one of the longest AITs, which is their special schooling. They've got a pretty high washout rate because they get into like everything we're talking about times 100, right? We get into like tactical evaluation. Or evacuation. We're kind of speed this up. So for tactical evacuation, initiate tactical evacuation phase, provide an appropriate first aid, transfer casualty to the evacuation site. That'll all be picked by myself as your platoon sergeant. I'll have the area, the HLZ, the hot landing zone, or the AXP, which is the ambulance exchange point. We'll monitor for shock. So basically, once the casualty is packaged up, meaning we've sustained, he or she is doing maybe not great, but they're alive and we can move them. We're going to monitor for shock throughout the whole movement, okay? And then continually reassess until medical support arrives. What that means, essentially, in a nutshell, is let's say I'm down, I'm out, you wake me up, I'm good, I'm alert, you're not just going to walk away now and be like, all right, he's fine. You're going to continuously reassess, talking to me, make sure everything's good, does it hurt anywhere, all that kind of stuff. Does that make sense? Cool.
So the asterisk there on the bottom, if you think they have a broken back, you should not move them unless it's to literally save their life. So if they're under fire, then you can move them, right? But yeah, broken back, broken neck. If it's safe to leave them there, you leave them there.
All right, opening the airway. Safely position the casualty to open the airway, sweep mouth of any foreign material.
Literally using your finger.
Head tilt, chin lift method. Check for breathing, and then the NPA I was talking about. So the head tilt, chin lift method, you're gonna hear this a lot. It's just hand on the forehead, gently lifting up on the chin, and then opening the mouth. It's just to straighten out the, what's this thing called? Come on, help me out, yeah? All right. Yeah, we'll just say it is, okay? The throat. Basically, we're just kind of open that up, right? Because if we're too far extended, it stretches it, and if we're too cramped up like this, it's hard to breathe. So that's it in a nutshell. The Army just makes it sound crazy, but it's just what it is. Tilt the head back a little bit, right? Open the mouth, inspect, because who knows, something might be in there. If there's anything in there, just sweep it out, right? And then we're just going to open it up. And if they start breathing, great. If they're not, how do we check for breathing? We can listen and feel for breaths. We can watch the rise and fall of the chest, those types of things. And then the last thing would be the NPA, which I told you guys is that tube that goes on the nose. It doesn't feel good. I've had it done, I think, 3-4 times in my career. It burns. All right, it was done for training, not because I needed it. I was a guinea pig. All right, next slide, sir. All right, tourniquet. You guys know what a tourniquet is? All right, I can use my belt for a tourniquet. You could rip a strap off. Yeah, shoelace. Not preferred because it's skinnier.
Yeah.
But yeah, so I'm not going to read you how to use a tourniquet because it's better to just have what we use right here to actually explain to you. But what I will say, the big things to point out is placing the tourniquet 2 to 3 inches above the wound. So if I have an injury right here on my arm, like lower arm, we're not going to put it on the joint. We're going to put it just above the joint. So we'll just say I've got an injury like just below my elbow right here, and it's bleeding profusely, right? You're going to slap a tourniquet on there, okay? So it's about 2 to 3 inches above the wound. You're going to tighten the windlass. The windlass is this strap right here, this plastic piece. Basically, you're going to wrap it around, and again, it's hard to explain without being able to show you, but once the tourniquet itself's on there, it's Velcro, then you're going to start tightening that thing until the bleeding stops. Then you're going to secure it. There's like this little strap in here. You're going to secure it, okay? When you apply a tourniquet, you have to check for distal pulse. So let's say you got a tourniquet on my arm right now, right? I'm bleeding out of here. Where would you check for distal pulse? Down here, right? If you apply a tourniquet and you feel a pulse, is the tourniquet doing its job? No. So then what do?
Tighten it more.
You can try to tighten it more, right? But let's say it doesn't work.
Put it higher up.
Grab a different tourniquet. You're going to leave the tourniquet that's on there on. You're not authorized to remove it. You're going to put another tourniquet on. You're going to put the next tourniquet on right above it, ideally touching. But you don't want more than 2 inches apart between the second tourniquet. That's if the first one fails. Why do we want more than 2 inches in between the tourniquets? So I put, let's say this one's on my arm and that one fails, right? We leave it on. Slap on a second one. We want them to be touching, but no more than 2 inches apart if they can't touch for whatever reason. Why don't we want a bigger gap in between those two tourniquets?
You don't want the whole arm to.
So there's a thing called compartment syndrome. Okay? What happens is this. Put a tourniquet on me right here. It's not working. You can feel my pulse still, right? It's maybe faint, but it's still there. Again, you cannot remove that tourniquet. So you slap the second one out. I got that little bit of a gap. Compartment syndrome is this thing where the blood starts to pool up in between both tourniquets. It builds up this toxins, right? Since you're not authorized to remove the tourniquet, those could be on for an hour, 30 minutes, something like that, until you get into the higher echelon of care. Once higher echelon of care takes those tourniquets off, that blood's going to get released back into the body. When blood pools up, again, it's called compartment syndrome. Those toxins start to build up. I don't know where it comes from. Right? That's what they teach me.
CO2.
It basically just blasts out to the body, and it can be lethal. Okay, so no more than 2 inches apart between two tourniquets. Ideally, you want to be touching if the first one fits. All right, you're going to hear a lot of cadets here talking about high and tight, meaning you got a wound here. Let's go way up to the armpit. You don't need to do all that. No more than 2 inches above the wound. Okay, good.
Generally speaking, you can have a tourniquet on for something like up to 8 hours before there's permanent nerve damage. It's longer than that.
So go back, sir. After you've got the tourniquet on, so let's say the first one we put on, it worked, everything's great. Your IFAC 2, the first aid kit you have had a marker in it. You're going to write T, which is going to let everyone know tourniquet, and then you're going to write time. Now, you see how it's got it right here? It doesn't make sense, right? The Army was like, hey, make me these tourniquets. We're going to pay you a shit ton. We're going to pay you a bunch of money. We're going to pay you a lot of money for these tourniquets, right? But what's the last thing we got to do right here? What's it say? Secure tourniquet in place with tape, right? That doesn't mean we're just going to put a piece of tape over it. That means you're going to wrap it with tape in real life, okay? So wrap it and then T and then time. The reason you're writing the T again is so everyone knows that it's a tourniquet, right? I get it. It's a tourniquet. Everyone should know, but whatever. The time was what the medics know what time was applied and was effective, okay? What time it was applied and was actually effective, okay? If you don't have a marker to write T and then the time, you can take blood and put T and then the time on the forehead. It's a method. What's up, bud?
Do you do so once the pulse stops, right? It stops breathing, that you write the time.
Yes.
That happened.
Yes. Once the tourniquet, it's on, you're tightening. Bleeding stops, just the pulse, nothing there, everything's good. Boom, time. And we're going to wrap it. Make sense? Good? All right. I know we're tired. It's been a long day. But guess what? All right.
Longer day.
Sir?
Is that anyone? Check signs, position, palm. Yeah, so you want to reassure them because if they start panicking, that raises the heart rate, and that's not what you want. Like he said, he told you the story of the cadet who died last summer. They went into shock. And, all right, so we're going to skip this because we're going to be doing it at the FTX. And then we're going to go into the next two slides. Any questions about the basics of this? No? Okay. Into Fieldcraft. And there's going to be a video after this. All right, can someone read this one? Okay. Maybe you can. Someone else lost her voice.
What part do you want me to read? The whole thing?
Yeah, just read the whole thing.
All right. Fieldcraft is an essential element of tactical knowledge that leaders must understand, teach, and enforce during both training and operations. Fieldcraft encompasses all of the techniques associated with operating and surviving in austere, hostile field conditions, like camouflage, noise and light discipline, and field sanitation. Leaders set a positive personal example in terms of fieldcraft and ensure subordinates adhere to prescribed standards in a disciplined manner. Good fieldcraft is an indicator of a well-disciplined and well-led organization. Leaders gain proficiency in fieldcraft through education and practice during training.
Okay. So, this is for you guys. The we'll do 5 minutes. 5 minutes, fine. Okay, think of health threats during military operations, and then we're going to write them down, right? We have whiteboard in here. We don't.
Is that pen and paper? Any book bags? Just one person.
There's only a couple of us.
5 minutes to identify as many health threats in military operations. All right, let's do it. I'll help you all out.
Yeah, let's take notes here.
What do we got?
Keystrokes.
Good.
All right, you talk out loud. I'll just record it here.
Enemy.
Heart attack.
Enemy fire. This is like a combat situation.
Anything. Military operations today. Today was not necessarily an operation, but the Ruck March, right? So take 5 minutes to identify as many health threats in military operations. So let's think. We'll think right now.
Sprained ankle.
Sprained ankle.
So yeah, we'll keep it simple right now. Think more OTC. So this one we did a Ruck March.
Fall down and break your arm.
I mean, yeah.
Someone did fall down, right? The way you were running, jeez.
Dehydration. All right, now let's push it out to next week. For instance, FTX. We're gonna be out in the field. What are some things that you guys think of? Or that come up with?
Hypothermia.
Yeah, potentially.
Sleep deprivation.
What else?
Possible accidents while using equipment.
Yeah, but we're talking health threats. Would you guys consider like poison ivy or poison oak a health threat? No,
You're allergic to it.
you're allergic to it.
Snake bite.
I mean, that's a thing. These are health threats.
Yes.
That's life, limb, or eyesight, right? The big thing is life, limb, or eyesight, right? That's a big thing. What else you got?
Flying objects.
Man, you just be throwing random stuff out there.
Yeah, UFOs.
Take 5 minutes.
But if you're like walking in like a branch post, I really
Yeah. But let's talk. Let's think. Let's focus back to. Let's think of like AFT now, right? AF. We're gonna do the PT test operation. What are some health threats from that?
Blow your back out.
I think we kind of covered like the majority of health threats. Now, if you would, you know what? We're not gonna get into the combat because I think we're gonna get off topic. We're talking health threats, not being shot and all those other kind of things. Specifically, like the health. Okay. So it's a heat exhaustion or a heat stroke. Mm-hmm. Do we have it? Okay.
We don't have heated guns.
Wait, you said heat stroke? Okay.
Which one is it? Stroke? Exhaustion's next, right? Exhaustion.
What else we got?
And then
Put yourself in a leadership position. And you're about to take your platoon to go do whatever type of training that's going to require anything, whether it's a lot of physical exertion or whatever. Like, what are some things that you as a platoon leader would be concerned about from a health standpoint? Not getting killed and all sort of wild stuff, but just from a health standpoint. Yeah, that's a good one. Yeah. I think we kind of covered everything for the most part. So I think we're good.
yeah, and you can go back to like the Oregon Trail kind of thought. You know, dehydration, no food, you get malaria, dysentery because you drank bad water. You know, those are things that you think about health threats in a military environment.
That makes sense.
This is good. This is good. These are the things that you can mitigate. Okay, you can mitigate these things, most of them.
So, the reason I was like, let's avoid like the combat, like I think you brought up at the beginning, not everything in the military is going to be combat related. And a lot of times, cadets, basic trainees, and I'm a drill sergeant, basic trainees, it's always combat. And I'm like, listen, not everything's combat related. You guys are going to leave here in what, 3 years, some shit like 3.5 years? You're going to be a lieutenant, and then you're going to be in charge of people. And not everything is going to be combat related. So you're going to have to take into consideration health concerns at just the base level. Like, for instance, this morning at the ruck march, you guys show up, you throw on the ruck, and you go walk. You come back, right? What you don't know is that behind the scenes, yesterday, we had a meeting, public cadre, and we just started listing out, like, hey, what are some contingency plans? What if somebody gets hurt? Right? So you guys told this morning to bring your cell phone every so long, right? Like, we put all these things in place to prevent or minimize or mitigate, like, whatever injuries we can. I'm hoping somebody told you guys to make sure you hydrate, eat food the night before, all those kind of things. These are all things that we put out to your cadet leadership, put out to you guys to kind of mitigate these things, right? Health concerns. Heart attack was on the list, but like heat stroke. It's cold this morning, right? But it was chilly. As a leader, what is something that you like would want to check one of your subordinates or how to go on a 6 mile foot march or a ruck march? We wear underneath our uniform sometimes snow gear, keeps us warm, right? A lot of times, privates and NCOs, lieutenants, you guys will wear snow gear to stay warm.
Too much.
Because it's cold in the morning and you don't take it off where you're on a ruck. Yeah, go ahead, say it. I know you're thinking of something. You did the point. Did you do it?
But no, he was doing it. I was teasing him.
Oh, you did it?
Well, actually, this right here, I wore this. It's very thin.
What is it? Like a moisture wicking thing?
Yeah, kind of.
But it keeps you warm.
Yeah, it provides helps keep up my core temperature. But
Okay,
I didn't overheat while wearing it. So
It's all good. But what I'm saying is like those are the things that was like as a leader, because you'll have some of your subordinates, like I said, that'll want that stuff. And now, yeah, it's cold, so I don't think heat's going to be a problem. But then you find out it is a problem. Like I was in Lithuania last year in Poland, and somebody that is training, and it was cold as hell. It was horrible. And before we go out and do like platoon stuff, where we're going to be running X amount of kilometers and shooting all stuff, I'd be like, yo, like let me see your sleeves. They pull it up and have your snivel gear on. Like go to the truck, get the striker, take that shit off, because you're going to pass out. And then they do pass out, I guess you get in trouble. Me and you, my PO, and then they yell at us, so why you got shit? So it's not just it's identifying and then figuring out ways to mitigate. Okay.
Yeah, being able to identify heat stroke, heat exhaustion. One thing that's interesting is you overheat, now you're sweating, and then suddenly you stop sweating and you feel cold. Okay, now you're going into, I think that's heat exhaustion going into heat stroke. So
The cool climate skin. It's gross.
Yeah. The exact opposite, cold weather stuff, right? Based on this picture. Frostbite, what's going to go first? Nose, ears, fingers, okay? So you got to worry about that. Captain Cook was telling me a story about his time in Ranger School this morning. He was there during mountain phase and it was winter and snowy, so they didn't allow them to sleep on the ground because what's going to happen is someone's going to fall asleep and then they're going to lose a nose. So they made them just actually walk in circles. So you as a commander need to be aware of those things. Being physically fit helps keep your immune system up. And the opposite, if you're out of shape, lower immune system. Sanitation, right? This is probably, I think they're trying to say that this is sewer water backing up. Okay, that's pretty gross, but it smells terrible. Okay, soldiers perform individual techniques of preventative medicine measures. Field sanitation teams train soldiers in preventative medicine measures and advise commanders and unit leaders on implementation of unit-level preventative medicine measures. Commander and subordinate leaders provide for and enforce preventative medicine measures. Most important thing you're going to do with this is going to be water. How long do you boil water?
Just 10 minutes.
10, 15 minutes. Okay, rolling. It's a rolling boil. When you boil something, it does not get rid of the toxins in the water. Okay, it will kill bacteria and viruses, but if there's, iodine in there and you're drinking that, it's not going to get rid of whatever toxin is in there. So it's something to be aware of. And we need to do another whiteboard. Did you guys, you want to spend 2 minutes thinking about this? We'll do 2 minutes. Talk out loud. Let me get my text box going. Okay, so preventative measure said boil water. Okay, stuff like that. What can you do?
Drink water.
Drink water. Hydrate. Okay, what you got?
General sanitation.
Sanitation.
Checking individuals to make sure they're in proper uniform, dress for activities. So making sure they're not wearing
Proper attire for the activity. Yeah, if you're gonna I shouldn't tell you the secrets of the trade, but you're gonna do a run at some point in a pro mask. Okay, you guys have probably never seen a pro mask. There is in the mask where you would breathe. There's a little plastic piece. Okay, when you breathe out, that plastic piece extends away from your face so the air can leave. And then when you breathe back in, it closes up so you don't get the toxic air where you're trying to breathe, right? Well, if you're going on a run and you know it's just a thing, well, you take out a plastic piece and then you just breathe normal, okay? And you'll crush it. But anyways, so wearing the right attire, right? So you don't overheat. Anything else? Preventative measures?
taking, I think it's like calcium or whatever for cramps. Mustard,
Vitamins?
that sort of thing.
Right.
Right,
Weird.
cramping.
Vitamins. Okay. I'll say this. How about just proper nutrition? So, nutrition. So, everyone loves, well, I guess, I like hamburgers, but you can't have a hamburger every day. All right, you got to balance it out. So, that's part of our holistic health and fitness, or H2F. So, be in shape, boiling water, sanitation, changing your socks. Okay, these are preventative things we can do. Anything else come to mind? It's okay if it doesn't.
Staying dry in wet conditions.
Try to stay dry.
Don't eliminate trench foot.
Yeah, so that's a big one, right? If your feet are bad, then everything else is going to be bad. Okay, so we're going to watch this video. We got 10 minutes, so we're going to watch this video. And then I'm going to show you like really gross stuff because that's what they...
On February 24th, 1944, the 5307th, with an initial strength of 2,750 officers and men, began a history-making march through the enemy-held Himalayan foothills into the jungles of Burma. Their ultimate objective, to capture the strategically important Japanese-held airfield and town of Nichinor, more than 800 miles away. At times, they were forced to leave the trail and head through the mountains, struggling up steep slopes, hacking a path through dense bamboo thickets, unloading mules so that they could make it through, then transferring their load onto the men. Reliant on infrequent airdrops for resupply and subsisting on K-rations, the marauders were hungry all the time. Malaria, scrub typhus, and amoebic dysentery inflicted more casualties on the marauders than did the Japanese. In addition to inhospitable terrain, monsoons, contaminated water, leeches, flies, snake bites, exhaustion, and the constant threat of attack, they endured hunger, malnutrition, and disease. Leadership, loyalty, and the will to survive is all that allowed the marauders to continue. Operating behind enemy lines, the marauders were able to outflank Japanese forces and cut off major supply roads. At Wallaboom, while under massive artillery attack, they killed more than 800 enemy soldiers and forced the Japanese to withdraw. In contrast, only 8 marauders were killed and 37 wounded.
From a captured enemy map, General Frank Merrill, commander of the Marauders, learned that a large Japanese force, possibly 2 battalions strong, was planning to move north and attacked the flank of the Chinese 22nd Division near Chatusa. General Joe Stilwell, the Allied commander, General Joe Vinegar Stilwell, ordered Merrill to block the trail north of the village of Nepunga and stop the enemy from reaching their objective. Merrill placed the 2nd Battalion on the high ground at Nepunga and deployed the 3rd Battalion to defend an airstrip 3 miles to the north. Almost immediately, the Japanese began to attack. For the next 10 days, 2nd Battalion was under continuous fire while the 3rd Battalion battled to reopen the trail. And there were 57 Merrill's Marauders killed and over 300 wounded at Nepunga.
Every wounded marauder was evacuated. The brave pilots of these small Piper Cub evacuation planes would land and take off in very hazardous conditions, removing every seriously wounded marauder one at a time. On May 17, 1944, they succeeded in capturing North Burma's only all-weather Michinaw airstrip. They accomplished this by defeating the much larger elite 18th Japanese Imperial Guards Division in 5 major battles and over 30 minor engagements. At the end of their successful mission, only 130 officers and men of the original 2,750 were fit for duty. No other American force had marched as far, fought as continuously, or had or displayed such endurance as the swift-moving, hard-hitting foot soldiers of Merrill's Marauders. For their accomplishments, the Marauders were awarded the Presidential Unit Citation, awarded by the President in the name of Congress for extraordinary heroism in action. The Marauders also had the extremely rare distinction of having every member of the unit receive the Bronze Star. Today's United States Army Rangers are direct descendants of the Marauders.
Okay, so, again, it's not just the enemy, it's causing casualties, it's healthcare. All right, so I think we do the Kahoot, and then I discussed you with this, what is this going to be for us? Anyway, all right, so let's do this Kahoot before we do the first. You're gonna hate it. You gonna play?
Yeah, sir. I'm gonna lose my play.
All right, everyone, let's go. Should be an image. There you go. What is that? All right. Oh, this one is tough. What's not included? Oh, I did that. You gotta bring your own Motrin. Actually, there's reasons for that. If you are wounded, we actually don't want to give you any kind of medicine because the medics, the real medics that are coming in, whatever you give them might complicate that, and that might end up killing them. So that's why you don't want to self-medicate them. First thing you do when performing care under fire. Hey, fight back. Okay, broken back or neck. Can you move casualty? Right. So if it will save their life, you can do it. If not, you leave them. Which of these tasks associated with first aid? All right. So the reason this secure the windlass, that is part of the task of applying the tourniquet, right? That's a subset of that. That's why that one would be wrong. What term is used for transporting casualties aboard a non-medical vehicle? Non-medical. Right? Non-medical casevac. How many lines are in a medical evacuation? We didn't talk about this. All right, so we call it 9-line medevac. Yeah, we didn't discuss it. When we do our FTX next week, we'll make you go through the whole thing and have to do all 9 lines. Okay, birds in again, it's random. So you don't need all 9 to get the birds flying. How many do you need? I think you've ruined everyone's guess there. You need 5, okay? You need 5. They need to know what's happening. So if they got like a broken back, they need to know they need some sort of stretcher. Right? Where am I going? How many casualties? And then they'll start flying. You can give them the additional 4 when they're en route. But we will go over that next week. Oh, right. Oh, Lenny. And number 1 is someone. Bobby. You last week? 2 weeks ago? Okay. Just taking turns on that. Okay. 10 o'clock now. So the class is theoretically over. We can go over this, which is for us, we'll go through in like 5 minutes, I guess. We'll go through quick. Okay, so when you go to CST or Cadet Summer Training, this is what they're going to show good, proper field hygiene. You're going to be in the field for like 30 days. So it's field hygiene. Urinary tract infections are a big deal, especially a big deal for females. Fungus on your groin, gross, because you might not take a shower. That's why when we go to the field, I think I told you guys to bring baby wipes. Okay, bring your baby wipes. You go. Always clean your hands when you can. Porta potties, right? That's more sanitary than just pooping in the ground, I guess. Like hand washing in laundry facilities and enclosed showers. Then you're going to have physical and emotional stress. Okay, what defines an austere environment? Not readily available running water, potable water. Okay, unless it's brought in. So it's a challenging environment. If you got nowhere to pee, you can cause bladder damage. Another thing, so you need to find a place to go pee. You don't want to just pee on the ground where you're going to spend a lot of your time, because then there's going to be on the ground. All right. Female hygiene. Bladder stores urine. It's sterile. Doesn't contain bacteria. Bacteria lives on the skin. Since most of you are men, why do you need to know about female anatomy and biology?
Because they're in the field with us.
Because they're in the field with you, and you're going to be a commander at some time, and you're going to have a female. Okay, so you need to understand these things. You also might have a child or get married, so you need to understand these things to a woman. So, you need to know that. There you go. Again, you're not children. Hopefully you know how to go to the bathroom. But again, when you're in the field, something different. If you do get a wet shirt or underwear, try to change it. Okay, this is where the bacteria is going to grow. This is where you're going to get rashes. Right? Damp, wet, soiled. Right, that's all bad. Apparently they have this for women, so I don't know if we'll have it there, but I mean, they have it in most porta potties too. Now, if you go pee, it's normally to the side of it. For the guys, you just pee in that, and then it goes away. But there you go. Okay, these are gross. Really gross. Ringworm, athlete's foot, jock itch, yeast infection. Gross. People are gross. I'm gonna move on. If you want to research more, then go to WebMD. Figure it out yourself. Keep the skin clean. That's important. Body powder, right? Keep your skin dry. We change socks when we can. If it gets wet and you know you're going to be out of a wet condition, then change your socks, and you can dry them around your neck. You can hang them from your backpack or rucksack or whatever. That's a big one. Keep your feet dry is huge. Air them out as much as possible. If you're just hanging out, good. Try not to sleep with your shoes on, okay? Because same reason, your feet need to air out. Itching, irritation, abnormal discharges, seek medical attention. Here's a list of things you can bring. Sunscreen's huge. Maybe not now because it's the end of October, so it's probably not just going to get sunburned. But if you get burned today, for the next 4 or 5 days, your life's going to be miserable. Toilet paper, no one's going to bring it for you. Baby wipes. Insect repellent is huge, right? We're here on the East Coast, and there's insects everywhere, and they want to eat you. So bring insect repellent. Here's your female hygiene list. No perfumes. I don't know. Everyone's going to smell terrible anyway, so whatever. Bring a Ziploc bag. It's a big one because you can't just throw it on the ground because other people train there. I could say tactically, you don't want to leave evidence of somewhere you've been, so you don't leave trash on the ground either. Otherwise, the enemy can know you were there. Nothing new. Sunday baby wipes. Don't do personal hygiene in a porta potty. This is, setting up the poncho again. That's the discretion part. Humility and shame, I guess, that we have. But you do want to check for ticks. Okay, ticks are a big one. I think we might be okay. I think we're late enough into the season that there's no more ticks. But you don't know. They're going to crawl on you. You will feel them crawling up your body. So bring an extra uniform. Anything else on here? Give someone face paint prior to shaving. Again, you don't want to infect whatever. Wash your hands. So every time you get your MRE, there's going to be a hand washing thing in there. So a sanitizing wipe. So use it. Clean your hands off before you eat. Okay, these are all common sense things. Just think about before you go. Okay, any questions? All right. So that is your basic first aid, and we'll do your hands-on training next